World War I, often referred to as the Great War, brought unprecedented challenges not only on the battlefield but also in the realm of medical care. The conflict's scale and intensity demanded innovative approaches to address the physical and psychological toll on soldiers. This video explores the evolution of medical treatment during World War I, from the frontline trenches to the rear medical facilities. 1. Battlefield challenges. The nature of trench warfare presented unique challenges for medical personnel. Soldiers faced injuries from shrapnel, gunshot wounds, gas attacks, and the harsh conditions of life in the trenches. Immediate medical attention on the battlefield was crucial to saving lives and preventing infections. 2. Triage and evacuation. Triage systems were implemented to prioritize the treatment of wounded soldiers. Medics and stretcher bearers quickly assessed injuries and determined the level of urgency. Evacuation routes, often perilous themselves, were established to transport the wounded from the front lines to more extensive medical facilities. 3. Field dressings and first aid. Field dressings, typically consisting of bandages and antiseptic materials, became standard issue for soldiers. The application of first aid on the battlefield by fellow soldiers or medics played a vital role in preventing infections and providing immediate relief to the wounded. 4. Mobile surgical units. Recognizing the need for swift medical intervention, mobile surgical units were deployed near the front lines. These units, equipped with rudimentary operating theaters, allowed surgeons to perform essential surgeries quickly. The focus was on stabilizing patients before they were transported to more comprehensive medical facilities. 5. Advancements in surgery. World War I saw significant advancements in surgical techniques. Innovations such as the Thomas splint for fractured limbs and the use of X-rays to locate bullets or shrapnel revolutionized the approach to surgical care on the battlefield. 6. Gas attacks and respiratory care. The introduction of chemical warfare, including gas attacks, added a new dimension to medical challenges. Specialized units were established to address respiratory issues caused by gas exposure. Gas masks and decontamination procedures became integral to medical care. 7. Medical transport. The evacuation of wounded soldiers relied on various forms of transportation, including ambulances, horse-drawn carts, and later in the war, motorized vehicles. The development of efficient transport systems was critical for delivering casualties to more extensive medical facilities quickly. 8. Role of nursing. Nursing played a crucial role in providing care to wounded soldiers. Nurses worked tirelessly in field hospitals and rear medical facilities, administering treatments, comforting the injured, and often facing challenging conditions. 9. Psychological trauma and shell shock. World War I witnessed a growing awareness of psychological trauma, then termed shell shock. Medical professionals struggled to understand and address the psychological toll of war. Treatment involved a combination of rest, counseling, and, at times, more controversial approaches. 10. Legacy and post-war impact. The medical advancements and lessons learned from World War I had a lasting impact on subsequent conflicts and the broader field of medicine. The war catalyzed developments in prosthetics, rehabilitation, and trauma care, setting the stage for improvements in medical treatment in the years to come. Medical treatment during World War I evolved in response to the unprecedented challenges posed by the conflict. From the frontline trenches to the rear medical facilities, the dedication of medical professionals, advancements in surgical techniques, and the recognition of psychological trauma collectively shaped a legacy of wartime medical care that continues to influence modern practices. The Great War was not only a crucible for military strategies, but also a catalyst for medical innovations and a deeper understanding of the human cost of conflict.